Paxlovid is a drug, which is an oral drug, which is used against COVID-19. It is a product of the Pfizer company, which has also made the messenger RNA vaccines, which are in the news nowadays. They are repeatedly in the news because of major problems with the vaccines, especially in young boys. Now, apart from that, of course, we come back to Paxlovid, which is a tablet which is given for 5 days, twice a day for 5 days, and it is supposed to be very effective in curing COVID-19. There was a study called the EPIC-HR study, which was a study in patients with COVID-19 who were at high risk. This was given within 3 to 5 days of the onset of symptom, and the researchers found that in a double-blind randomized study, there was an 89% reduction in hospital admissions or death. Therefore, a very big, significant benefit with Paxlovid. But the important thing is we have to consider who did the researchers think as high risk. These were people who were smokers, about 39%, hypertensives, about 32%, and of course obesity, which was defined as a BMI of more than 25. So actually not very fat, but there was an 89% reduction, a relative reduction in hospital admissions or death. And therefore, the NIH says in its official guidelines, which is freely available on the internet, that Paxlovid is the only highly effective oral antiviral therapy for COVID-19. Now, this, of course, is bordering on fake news, because when another study was done by the same company, that is Pfizer, this was done in standard risk patients. That means this time they included patients who had been vaccinated. The earlier study did not have patients who had been vaccinated. Now they included patients who had been vaccinated and had standard risks, and they found that there was no benefit. There was no benefit with Paxlovid in this study. So therefore, we are now left with a debate as to whether one would employ Paxlovid in a patient who has been vaccinated. Also, there is in these guidelines on page number 191 or 192 some very peculiar lines, which are, according to the National Institutes of Health, if you have been vaccinated, you are at a higher risk for severe COVID-19, as opposed to being not vaccinated, in which case you are at a lower risk for high-risk COVID-19. I will repeat this. In fact, the guidelines themselves repeat this twice. That is, in the same paragraph, that a person who is vaccinated is at a higher risk of severe COVID-19, as opposed to a person who has not been vaccinated, who is liable to a lower risk of bad COVID-19. Now, this is a remarkable sentence. Either there has been a typing error, or this has not been proofread, or this is a Freudian slip. I repeat again and again. I can go on and on, but you will get bored. What the National Institutes of Health is saying, that if you are vaccinated, you are liable to be at a greater risk for more severe COVID-19. Now, this again is again and again, I am a bit amazed, astonished at these sentences, which have been published, and are presented on this PDF, which is freely available on the internet. So, point number one is that this drug, which is an oral drug, is not effective in standard risk patients of COVID-19. And if you have been vaccinated, it again is not effective. And we all know that the majority of the population in most parts of the developed world, including India, have been vaccinated against COVID-19. The other point here is that there is something what is called a breakthrough infection, that is a breakthrough COVID-19, when one uses Paxlovid. This means you take the dosage, you take the oral tablets, you get free of COVID-19, but then it reappears after a few days. This is called COVID breakthrough. And the best example would be none other than Mr. Tony Fauci. Mr. Tony Fauci, please remember, has been vaccinated not once, but 4 times. Mr. Tony Fauci, who has been jabbed 4 times, first vaccine, second vaccine, first booster, then the second booster, still managed to get COVID-19. This time he took these this drug called Paxlovid. He took it for 5 days, and lo and behold, Mr. Tony Fauci developed what is called breakthrough COVID-19. That is, after a few days, he again had COVID-19. Mr. Tony Fauci has gone on record, I think it is on Reuters, that his symptoms are more severe this time, but he has also stated that because he had been vaccinated, he did not land up in hospital. But the problem is that I'm sure that Mr. Fauci got infected with the Omicron or a subvariant of Omicron virus. And we all know that the Omicron virus, as opposed to the Delta virus, is more infective, is more immune evasive, but is less toxic, it is less lethal. It rarely enters the lung, and therefore it doesn't damage the lung and doesn't damage the rest of the body. It is restricted to the throat and to the nose, and therefore it is less toxic. So most probably Mr. Fauci got relieved of his symptoms on his own. I don't know whether he took another dose of Paxlovid or what he took for his breakthrough COVID-19 infection. But the point is that most probably because he was infected by this Omicron variant or a subvariant, he did not get serious disease. So that is the second point regarding Paxlovid. Now what is the third point? The third point is again now on page number 198 we have a chapter on the drug-drug interactions with Paxlovid. Now what is a drug-drug interaction? Remember that whenever you take a drug, and if you take another drug along with it, there could be a drug interaction. One drug could affect the other drug. It could either enhance the efficacy of the other drug or reduce the efficacy of the other drug. Now these are called drug-drug interactions, and they are known because there are enzymes which are common to both of the drugs in most cases. Now with Paxlovid, the problem is that Paxlovid is reacting with multiple drugs, and sadly, unfortunately, a lot of these drugs are used in heart disease. In fact, it is found now that almost all drugs used in heart disease are interacting with Paxlovid. Now what are these drugs? According to the NIH guidelines and also according to a paper published recently in JACC, these drugs can be subdivided into one bunch which should never be given with Paxlovid and another bunch in which the dosage has to be altered. Now before I go into that, one drug which should never be given, which is absolutely contraindicated, is rifampicin. Now rifampicin is, for your information, the bedrock, the fundamental drug in treating tuberculosis. We know that 25% of the population of the world having tuberculosis is present in India. We have a massive burden of TB. And also we know that in a year more than 500,000 people die of tuberculosis in India, which means that at least one person is dying of tuberculosis per minute in India. Now that is a very big burden. Now you tell me that I'm giving you a drug which is the only highly effective drug against COVID-19, but it cannot be used in India because so many people are having tuberculosis. It cannot be used if the person is having rifampicin, which the person concerned is invariably using because he has tuberculosis. Apart from this, of course, I am coming back to the heart drugs. Now some drugs again in cardiology cannot be used with Paxlovid because they will either be rendered ineffective or they would become toxic. To begin with, the drugs which cannot be used at all with the Paxlovid are the heart failure drugs, that is ivabradine and eplerenone. Eplerenone is a mineralocorticoid receptor antagonist. Ivabradine is a drug which is known to increase ejection fraction and which reduces the heart rate. And it is a beautiful drug because it does not reduce the blood pressure. And I use it very frequently in my patients with heart failure. So ivabradine and eplerenone cannot be used with Paxlovid. Apart from this, you cannot use certain antiarrhythmics which are used very commonly. Again, one of the most commonly used antiarrhythmic, especially for atrial fibrillation, is amiodarone. Amiodarone cannot be used with Paxlovid, nor can be dronedarone, flecainide, propafenone, or even quinidine. So that is one bunch of drugs which should never be used with Paxlovid. The other bunch of drugs are statins. Now statins, again, as you all know, just about every person with heart disease is using a statin. Either he has been stented or has had a bypass surgery or is in heart failure or is having certain diseases such as blood pressure or diabetes. Just about every second person in the world is on a statin. Now statins cannot be used because if you use a statin, especially simvastatin or lovastatin, then the levels will rise very high and there is a chance of severe myopathy, and also there could be what is called rhabdomyolysis, which is a very serious condition. Apart from simvastatin, even atorvastatin or rosuvastatin has to be used very, very carefully. And apart from these statins, even ticagrelor, which is which is an antiplatelet, which is used very, very commonly after stenting, that is Brilinta, should not be used because the efficacy of Brilinta goes up and there can be bleeding because Brilinta or ticagrelor is a small blood thinner. Apart from this, even clopidogrel, which again is a very commonly used drug after stenting to prevent stent thrombosis, should not be used because that becomes ineffective, and therefore there's a very strong chance when used with Paxlovid that there can be the risk for stent thrombosis, which is again quite catastrophic. Apart from these drugs, then there are drugs which are used in hypertension, such as, and most of you would be using this drug if you have hypertension, that is amlodipine. There could be diltiazem, verapamil, and if you have heart failure, you could be using a drug called Entresto or Wymada. I have spoken about Wymada in my videos recently. This is a heart failure drug. Again, these drugs have to be adjusted very, very carefully when they are used with Paxlovid. Yet another group of medicines which are again very, very frequently used, especially in atrial fibrillation, are what are called direct or the new oral anticoagulants such as apixaban, edoxaban, and dabigatran. These drugs again have to be used very carefully because if when used with Paxlovid, their levels will go up very high. In fact, their levels could go up 7 to 8 times higher, and therefore there could be a chance of a serious bleed because these are drugs which are blood thinners. Now, what is Paxlovid? Paxlovid is a combination of two drugs, ritonivir and nirmatrelvir. Now, nirmatrelvir and ritonivir are combined. The job of ritonivir is to boost the levels of nirmatrelvir, and but don't focus on these tongue-twisting names. Just remember that the drug Paxlovid is a combination, is a chimera of two medicines which were also used against HIV, which are used against HIV, and one drug boosts the level of the other drug, and it is done so by interfering with an enzyme called CYP3A. Now that is the reason why Paxlovid is interacting with many drugs used in heart disease. Now, if I was to give you a choice, if you have COVID-19, to take in Paxlovid, would you do it? I doubt very much, knowing number one, that it would not be effective if you were vaccinated. It would not be effective if you had no serious risks per se to begin with. Number two, you could have what is called a rebound COVID. Despite being so-called cured by Paxlovid, you would have another repeat COVID-19, which could be more severe or as severe as the first COVID infection. And number three, if you are on a hard drug, then you have to be very, very careful. In fact, the list is so long, and almost every drug which is used in heart disease cannot be used with Paxlovid. Either it is absolutely contraindicated or some drugs have to be adjusted in their dosage. Of course, Paxlovid is used for 5 days, but 5 days can be a very, very long time when the question is of life and death. So I end this video by saying that the statement by the National Institutes of Health, which is on record, that the only highly effective oral viral drug against COVID-19 is Paxlovid, is to be taken very, very skeptically, and I would never advise Paxlovid in any of my heart patients because ultimately I am a cardiologist. Thank you very much.